Hello and welcome to your monthly update from the COVIDENCE UK study. My name's Adrian Martineau and I'm based at Queen Mary University of London, where I'm the chief investigator for the study. So today I thought I'd share again a bit more research that's being done by other groups on COVID-19 while we continue to crunch the data that you've kindly shared with us. And this is a paper led actually by a member of the COVIDENCE team, Aziz Sheikh, who's a professor up at the University of Edinburgh. But I hasten to add, this is not COVIDENCE work. This is work that he's done independently. I think it's a really important study. It came out in the Lancet just a couple of weeks back, looking at national data to ask the question around the effects of under-vaccination against COVID-19. So the background to this study is essentially relating to the UK COVID-19 vaccination programme, which, as you'll remember, began back in December of 2020. And the JCVI, the Joint Committee on Vaccination and Immunisation, made recommendations about who should get COVID vaccines. And those recommendations can simply be summarised as 1 dose for children aged 5 to 11 years, 2 for those aged 12 to 15, 3 for those aged 16 to 74, and 4 for those aged 75 plus, with additional doses offered to high-risk groups in the autumns of 2022 and the spring of 2023. And so the investigators asked 3 questions. First of all, how common is under-vaccination in the UK? Secondly, what are the risk factors for under-vaccination in the UK population? And thirdly, does it matter? Is under-vaccination a risk factor for severe COVID-19 outcomes? And before I share details of the methods and results, just a couple of definitions that the investigators used. The first was under-vaccination, which they defined as receiving fewer than the recommended number of SARS-CoV-2 vaccine doses as recommended by JCVI, as I described earlier. And in terms of what they considered to be severe outcomes, this was either hospitalisation or death due to COVID-19. So this study was done on a massive scale by analysing anonymised electronic health record data for the entire UK population aged 5 years or more. The study window was a period in between June and September of 2022. So vaccination status was assessed at the beginning of this window on the 1st of June 2022. And then COVID-19 outcomes were ascertained in the following 4 months, that is to say from the 1st of June all the way through to the 30th of September 2022. And when looking at associations between vaccination status and risk of severe adverse outcomes, the statistical analysis adjusted for factors including age, sex, ethnic origin, urban or rural residence, socioeconomic deprivation, and Q-COVID risk score, which is a measure of vulnerability to adverse COVID outcomes. So there were 3 questions, and I'm going to show you the results for each of these 3 areas. And the first of those was, what's the proportion of people who have not had a full course of vaccination against SARS-CoV-2? And this proportion is actually quite large. This national data set suggests that in England, 45.8% of people are under-vaccinated, in Scotland, 34.2%, Wales, 32.8%, and Northern Ireland, 49.8% did not have full vaccination on the 1st of June 2022. In terms of risk factors for being under-vaccinated, this was associated with younger age, living in a more deprived socioeconomic circumstances, being of Asian, Black, mixed, other or unknown ethnic origin compared to white, and having fewer underlying illnesses. And this, of course, one might understand because people who have fewer comorbidities might perceive themselves as being at lower risk of severe outcomes of COVID-19. So how many severe COVID outcomes were seen? Well, a total of 40,393 deaths or hospitalizations occurred due to COVID-19 in those 4 months, and they arose in 68.2 million people, of whom 45% were under-vaccinated and 55% were fully vaccinated. And if we look at the effect of what would have happened if everybody had been fully vaccinated based on the experience of those who were not fully vaccinated, the authors estimate that a total of 7,180 severe outcomes, either hospitalizations or deaths due to COVID-19, were averted by full vaccination during the study period. And you can see that there's what we call a dose-response relationship here. If you just look, for example, at data in the age 75 plus group, who are at highest risk of adverse outcomes, among people who had one dose fewer than recommended, they had effectively a 2.7-fold higher risk of a severe adverse outcome compared to those who were fully vaccinated. If they missed 2 doses, the risk went up to 3.1-fold. 3 doses, 3.6-fold. 4 doses, 3.1-fold. So you can see that with increasing number of doses missed, your risk of experiencing a severe adverse outcome increases, and that's after full adjustment for the socio-demographic variables I've outlined in the previous slide. So the bottom line from this study then is that under-vaccination against SARS-CoV-2 is really common, or at least it was common on the 1st of June 2022, and we have no reason to believe that that will have changed, particularly up to the current time. And this under-vaccination is associated with increased risk of hospitalization or death due to COVID-19. So I think the takeaway messages are that if you are eligible for one of these vaccines in forthcoming vaccination campaign, you should definitely go for it. But I think from the COVIDENCE UK perspective as well, what we're interested to see is who among the unvaccinated people currently is at risk of increased risk of adverse events. And we're currently doing an analysis nested within the COVIDENCE UK data set to look at that question, in particular to ask whether there are some groups who aren't currently eligible to get vaccine, such as, for example, some patients with asthma and COPD, who might benefit from it. And I hope to have results of those analyses with you in the months ahead. But for now, all that remains for me to say is a big thank you for continuing to stick with us all these months after the start of the study. And we look forward to seeing you again at the webinar next month. Goodbye.